Welcome to Ashley on CBD, your one-stop podcast where we drop the truth on all things CBD and maybe some pop culture too. Stick around as we delve deep into the practical health benefits of CBD for you.
Welcome to the show. Thank you for listening. Today's episode, as always, is brought to you by Magic Immuna Tea, available at packedwithlife.com. What could be more important in today's world than having a strong immune system? Probably nothing. But how do you do that? Diet, exercise? Well, no kidding. But what I've recently started doing is drinking Magic Immuna Tea. Number one, it tastes great, and it's loaded with healthy nutrients called adaptogens, including 4 essential mushrooms, reishi, lion's mane, chaga, and cordyceps. No, not the magic kind, you guys. Come on. Reishi, lion's mane, chaga, and cordyceps are great for you. Highly nutritious and very adept at boosting your immune system. So give Magic Immuna Tea a try at packedwithlife.com. Today's guest is Dr. Joseph Rosado, MD, from Florida, and he's focused on heart health, and he's recently written a book called Hope and Healing. So hope you enjoyed the show.
With a nutrition degree, and then I went to medical school. And then after medical school, I went ahead and got an MBA in healthcare management. So in some way, shape, or form, I've been involved in medicine since the age of 16.
Great. And you, if I read correctly as well, you have some chiropractic in your background as well, too.
Right. I went to chiropractic school after being a cath lab technician and before going to medical school.
Yeah, so I'm always interested in the combinations of those things because it's a holistic approach that I'm sure you bring forward. What got you into looking at cannabis as part of the solutions and that you're bringing to your patients?
When I was in medical school, believe it or not, of course, I went to medical school outside of the United States. I briefly learned about the endocannabinoid system. And it was a very small paragraph, and then immediately they went into the whole toxicology and how bad cannabis was. When I got home, I pulled out my Goodman and Gilman, which is really the pharmacological Bible, and read up on cannabis sativa. I put it in my mental Rolodex to remind me, that at some future point that it may serve a purpose as medicine. And then in 2010, one of my best friends in Arizona reached out to me and asked me to be the medical director for his dispensary because the law had just passed in Arizona, and a medical doctor had to be the medical director for the dispensary, or a naturopath in Arizona because naturopaths have certain levels of freedom there. And I was all set to go and get started, but his wife stopped the project because our kids at that time were teenagers. His son is a week older than my twin daughters. And, in her mind, it was like, well, we're telling our kids to abstain, but yeah, we're going to get involved in the medical cannabis industry. And so I called her up and I'm like, look, this isn't Joe and Don selling weed on the street corner. This is, Dr. Durst and Dr. Rosado. But, it ended at that point. And then 4 years later, in the state of Florida, where I live and practice, I saw John Morgan advertising for the campaign, Amendment 2. So I sent him an email and said, I'm a physician, I'm an advocate, how do I get involved? And 24 hours later, I was speaking with the campaign manager, and a week later I was on the Bureau of Speakers, and we just went off to the races. I participated in a lot of dog and pony shows explaining the use of medical cannabis and the decriminalization and using it for medical purposes, etc. 2014, in November, we failed. So we went back to the drawing board, and in November 2016, it passed. But by the time it passed, we had laws on the books already for Senate Bill 1030, which was the Compassionate Care Act, which allowed for high CBD to be recommended to patients. And then which was in the books June of 2014. And then in June of 2016, they added the Right to Try Act. So in August, I was the first in the greater Central Florida area to recommend a high CBD, low THC product to a 35-year-old female at that time with a brain tumor. And then 3 months later, I was the first in the state of Florida to recommend whole medical cannabis, a 1-to-1 CBD THC ratio, to a 15-year-old that had a stage 4 head and neck tumor. And I was on the news, I was on the TV, I was in the newspaper, I was on the radio, and that my practice boomed. And from that point forward, I weaned myself off of primary care and got involved solely in medical cannabis practice.
Wow. Well, congratulations. It's inspiring to hear. Are you, maybe tell us, give me, and our listeners an idea of some of the stories that you've seen, that you've been involved with. I think really this is one of the goals of what I'm trying to do here is to really educate and share stories and open minds. And, I think the stories are often the best way to do that. And if you don't mind, maybe just give us an example or two of some of the first things that come to mind with regards to the people that you've been able to have success with.
Well, certainly that young man, the 15-year-old, when he came to me, he was on a morphine pump. He was already in hospice. He'd been to St. Jude's twice, maybe 3 times, but I know for sure twice. And he had been a part of a clinical trial there. And when he went, the second or third time, they pretty much told the parents, look, we've got nothing more for your son. So this is pretty much it. So when they returned to Florida, they immediately he was in hospice. And so he was on hospice care, on a morphine pump, getting 16 milligrams of morphine infused into his, frail little body. Plus he had the capability of using it on demand, getting an additional 8 milligram bolus if the pain was so bad. He had a hospital bed in his bedroom, and all that child did was lay in this hospital bed, drooling and looking at his crotch because, 16 milligrams of morphine and somebody that weighs less than 100 pounds soaking wet is an atrocity. And so when mom agreed to, start this whole process and we got him on the cannabis, within 1 month, we reduced the amount of morphine that he was getting from 16 milligrams to 8 milligrams. So we literally cut it in half. He was now verbal. He was engaging with the family. He was living, sitting in the living room with his mom, stepdad, his brother and his sister. He was the best man at his brother's wedding. He danced with his sister at his brother's wedding. This is stuff. And although he did pass away in February the following year, what that entire family will take to their graves is the fact that from November until February, they had their little brother back. He was out and about and doing what he is supposed to be doing as a 15-year-old kid. Right.
That's amazing. It's such a good story. A lot of people, especially with cancer, it's not always, a miraculous cure, that it being cannabis or CBD, you see, but you often see a lot where the stories are very similar to where the time that you did have was maximized and therefore, priceless in terms of what the CBD or the cannabis might do for cancer in that sort of situation. I think one of the things that when I read about you before this is one of the topics I think I saw you talking about at somewhere else or at a conference perhaps was CBD and heart health, or cannabis and heart health.
Yes, that was very controversial.
Oh yeah? So tell me about that.
Oh yeah. Well, because cannabis, we've gotten the corner on pain, chronic pain. The number one reason patients come to our office, and pretty much nationally from what I hear from my colleagues, is chronic non-malignant pain or chronic malignant pain associated with cancer, pain associated with osteoarthritis, rheumatoid arthritis, lupus, fibromyalgia, et cetera, et cetera. We see that all day long. But to go outside of the box and discuss about a condition that is a condition that has been cornered by the cardiologist and the internist, where, this is my domain. And if anything happens with the heart, you either need medications or you need procedures like an angioplasty or valvuloplasty or anything like that. And if that doesn't work, then you need surgery. it's been cornered by that side of the market. And then for me to come around and say, well, you know what? Why don't we discuss about the endocannabinoid system and the heart and how there are receptors in the heart? And it was like, what?
Wow. What?
So I pissed off a few people.
Well, it's not always bad.
No, it certainly was not. It was not
getting
bad
a reaction,
at all.
right? So what? Tell us about that. Give us a little bit more about how that's working. With CBD and the receptors in the heart, or forgive me if it's cannabis. Either way, it kind of uses the two interchangeably since CBD is cannabis.
Exactly. Thank you very much. I appreciate you saying that.
Just obviously the non-intoxicating form. But anyway, tell us about cannabis and heart health in terms of how it works.
Well, there are receptors in the heart. There are CB1, CB2 receptors found in the heart. And in animal studies, they found that, for example, once someone uses cannabis, especially in the inhalation form, it works very intimately with the heart, because what happens is they get what's called a reflex tachycardia. The heart rate increases, and then, but at the same time, the blood pressure drops because of the relaxation that it occurs, but also it has a vasodilation component. It opens up the blood vessels. Therefore, by opening up the blood vessels, it lowers the blood pressure. So now you've got this opposing reaction going on. Heart rate increases, blood pressure decreases, and for the naive patient that uses medical cannabis, when they do that, they feel that sensation. And if it's too high or too potent of a chemovar or too high amount of THC, they freak out, and that's where they go into that greening out side of things, where they become paranoid, they get the palpitations, their mouth gets dry, they begin to hallucinate, they become, their pupils dilate, and they end up dialing 911, when all in reality they need to do is take some additional CBD, which would block, partially block that CB1 receptor, and the patient would now no longer have the effect of the THC, the adverse effect of the THC, but the benefit of the THC. So that's the first thing that happens, in that inhalation process. But as far as the inflammation and the antioxidant components, the biggest problem with disease in our bodies is inflammation, an inflammatory process. You have inflammation in a joint, it's arthritis. If you have inflammation in the heart, then you've got some type of cardiac problem, cardiac issue. And the more inflammation you have, the possibility of having an obstruction or an occlusion in the blood vessels, then that is going to cause a stress oxidation. It's going to stress out the system. Well, studies have shown that by incorporating cannabis in the form of CBD, THC, as well as all the other phytocannabinoids, it supports that oxidative stress. And what oxidative stress is, imagine rust on your vehicle or rust on anything that's metal. This oxidative stress is rust on your blood vessels, on your tissues. And by incorporating this cannabis into your body, it stops that rusting process, but can also reverse it. And that's the beauty of it.
That's great. Do you work with patients today on these things with regards to heart health?
Oh, I work with, yeah. I mean, we, since 2016 to present, we've managed a little over 4,000 patients in, over those 4 years. And the important thing to understand is that it's a multifactorial situation. I do not immediately take their blood pressure medication away or their cholesterol medication away or anything like that. We work in conjunction, but as I mentioned, because of the inflammation, the anti-inflammatory process of the cannabis, it helps to reduce triglycerides. It helps reduce bad cholesterol. It normalizes blood sugar. It doesn't make people as insulin resistant. So now we're reversing metabolic syndromes, reducing blood pressure, reducing the amount of insulin they're having to take, reducing the amount of oral anti-diabetic agents that they have to take. And so it's not uncommon for me every 6.5 months when I have to, by state law, see a patient, that I ask them, what has changed since the last time I saw you? You know, are you still on the same medications? What have you stopped using? What are you now using? And invariably, they will go through a list of 3-4 medications that they are no longer taking, from anti-anxiety, antidepressant, all the way to blood pressure medication, cholesterol medication, and diabetes medications. And a few of them have told me, you know, that their primary care physicians have weaned them off of their blood pressure medication because their blood pressures were so low. And the study was done just with CBD on individuals that were not hypertensive, did not have a history of high blood pressure. They gave them 600 milligrams of CBD, and they found that it dropped their blood pressure by 5 to 10 millimeters of mercury, both systolic and diastolic, top and bottom numbers. And these are people that are not pathological. Imagine the effect on people that are pathological, that have an actual disease. And so, you know, that's rewarding to do that. In conjunction with normalizing blood pressures and blood sugars, we're also helping them lose weight, because, you know, you've got one of the phytocannabinoids, THCV, that works on the GPR55 receptor that helps lower body weight, and losing that central adiposity or that central fat reduces, you know, helps them regain their health, their energy. Now they're active, they're able to exercise, they're riding their bicycles, they're swimming. And being that I'm in Florida, you know, there's no winter here. There's no reason why people can't be out. And in the summertime, when it's, you know, 100 degrees with 100% humidity, you know, you could always be doing something, or wait for the sun to go down a little bit and then go out and walk or run or ride your bike, or, you know, there's different activities that lend themselves to supporting what I'm doing with the cannabis.
Right. No, great. Thanks for that. That's very enlightening. Tell us about your book. I think you've got a book called Hope and Healing. Is that right?
Yes, I do. This isn't live. I mean, this isn't video. This is audio, right? Because I was gonna flash the book.
No, we have both. You can flash it. That's cool.
All right. So that's the book, Hope and Healing: The Case for Cannabis, written by me, with the foreword written by the gentleman that named the first endocannabinoid, Professor Lumir Hanoush. He named anandamide in 1992. Meshulam discovered it, and Professor Hanoush named it. And he and I met 2 years ago at an event in Colombia. And it was interesting because it's one of those serendipitous stories where you're standing in line getting ready to be interviewed, and I hear this gentleman ahead of me that's speaking English but has a very strong accent, and they're going to interview him. The person that was interviewing him did not speak any English. They were going to bring in a translator, and I went to the guy that was putting on the event and said, "Look, let me translate for him, because the translator you bring to him, translating English to Spanish or Spanish to English or English to Spanish is one thing. Translating medical terminology is a completely different animal. Talking about cannabis is even that's a unicorn. So forget it." So, and he said, "No, doctor, I don't feel comfortable having you, translate." It's like, "Look, don't worry about it. I'm fluent. It's okay." So the gentleman hears this exchange, and he turns around and says, "Thank you." And as he says, "Thank you," and I look at his face, and then I see his name, his badge, and I'm like, "Oh my God, Professor Hanoush." It's like, it's like meeting Jesus Christ, for a Christian. It's like, "Oh my God," it's like, "It's you." So it was so cool, gave him a big hug, thanked him for everything that he had done, etc. Requested a photo immediately, so no one could, so I wouldn't forget later on. And then I did the translation. We hit it off. We, exchanged stories. I asked him some questions. He was very, very just giving with his knowledge and his heart. And we had dinner. And then by the end of the weekend, I had posted a bunch of pictures all over social media. And the editor of the guy that was helping me edit my book and publish it said, "You need someone to write your foreword. Why don't you talk to him?" He's like, "And you need a beta reader. Why don't you ask him?" And I'm like, "Well, the worst that could happen is him saying no. So I approached them first to be the beta reader. So I went up to him and I said, I've written a book. This is the title. It's at the process to be read and just get some feedback. Would you be open to reading the book and just give me some feedback? And he's like, sure, absolutely. Email it to me and I'll get it to you as soon as I can. Like, great, thanks, I appreciate it. And as I was walking away, that little, gnat in the back of your head and your brain is like, ask them. And so I stopped and I turned around and said, can I ask you one more thing? And he's like, sure. And I said, if you like what you read and you feel comfortable, would you be open to writing the foreword to the book? And then there was this pause, this very polite pause, and I'm thinking, I'm screwed. It's over. I offended him. Now he doesn't want to read it. Like all the conversations that you have in your head, like, oh my God, I just screwed it up. Now he's not even going to want to beta read it. I should have not done this. And you're second guessing yourself, and we are our own worst enemy, beyond a doubt.
It probably seemed like it took minutes, right?
Oh yeah, in my mind it was like hours. It's like, right. Oh my God, I'm sweating and I don't usually perspire. And I'm feeling sweat all over my body. And all of a sudden he looks at me and smiles and said, "Yeah, I'll write you forward." I'm like, oh, thank you.
Yeah, very cool.
So that was my encounter with him. And then I sent him the book that evening. He read it on his flight from Colombia to Israel. And within a week, he had sent some, comments, some pointers. And a week and a half later, he sent me the foreword to the book. We added it to the book, and we were all set to move forward. And then the law changed in Florida, because originally, although Amendment 2 spoke about using flower and inhaling and smoking flower, Senate Bill 8A, which was the law that we were under, did not allow any smoking. So in March of 2019, they approved for the smokables to be available. So my book was all set to be like printed, ready to roll, and the law changed, and I pulled everything back and I said, no, I want my book to be as actual, as true to time as possible. So I added like a few pages to that one chapter and eliminated every part of the book that said smoking's not allowed, smoking is illegal. In the state of Florida, I removed all of that and then resubmitted it, and it was ready on, guess what date? 4/20/2019. No coincidence there.
There you go. Well, that's a great story. What's the book? What's the focus of the book? I mean, I can get an idea from the broad title, but what's inside there? What should we? The
first half of the book is like an A to Z for the novice, as well as someone that's wanting to get into it, get into medical cannabis, or just find out about cannabis. Because when I got involved with cannabis, there weren't that many books. There were a lot of articles, but there wasn't anything that I could really like sink my teeth into and get some information that wasn't written by an advocate or that wasn't promoting recreational use. This was more, something medical. And I wanted something medical because I'm a physician. That's what I do. Since the age of 16, I've been in some form of healthcare. And prior to the age of 16, when I was a child, I would go to the hospital with my dad, who was an X-ray technician at Sloan Kettering Memorial Hospital in New York, and hang out with him and talk to the different doctors and the different, healthcare professionals. So I've been in some aspect of some area of medicine since I was an infant. So it brought to light that something medical needed to be available. So the first part, I get into the history, when it was originally discovered, the law, the prejudices, the bigotry, the biases, and then moving on into the endocannabinoid system and the receptors and the different phytocannabinoids and how they work in the body, and for the different conditions that they work. I touch a little bit on dosing, on mixing different modes of administration to make sure you get the best bang for your buck. And then the latter part of the book is focused on the medical conditions that are approved in the state of Florida. So I go into discussing how cannabis works for cancer, epilepsy, seizures, glaucoma, HIV/AIDS, Crohn's disease, chronic muscle spasms, multiple sclerosis, Lou Gehrig's disease or ALS, PTSD, Parkinson's, as well as chronic pain, which although chronic pain is not one of the qualifying conditions in the state of Florida, we can maneuver and have the patient qualify with that diagnosis. So it helps to be able to do stuff like that. So the second part of the book is more stories, like you mentioned earlier, because people gather and learn more from sharing testimonials, sharing stories. So I speak of different people that I've either worked with or helped, or people that were in the limelight, like Charlotte Fiji, Charlotte's Web, her situation with Dravet's and her story of seizures and how her family evolved, and even Sanjay Gupta. Dr. Gupta became a believer from being someone that was, no, absolutely not. There's no benefit to this, to, creating 5 different documentaries on cannabis called Weed, and becoming a huge proponent and advocate for it. So, that says something about the plant and how it unites people and how it makes people kind of drop their belief system and open their mind to, something greater.
So given all that, I couldn't agree with you more, but why isn't the endocannabinoid system taught in medical schools?
Oh man, how much time do we have?
No, I know, you know what I mean? I don't know.
I mean,
I have my beliefs, but I'm looking for some logic. Like, is there any logic to this? Like, why is
no, there's no logic. It's hypocrisy and it's greed. As a physician, as a former medical student, and as a former primary care physician, we were wined and dined. Not at my time, in my era, we did not get kickbacks. We were not taken to Hawaii on a cruise. We did not spend, endless summers in Europe or the French Riviera. That's not my story. That didn't happen for me. What did happen for me, however, was when I was in training, as well as in medical school, we would get books given to us, or we would get supplies given to us, or we would get, different areas. And whenever they gave it to us, inside the book or the equipment or whatever, it had the name of the company that was providing that to me. So there's this subliminal
programming
interaction going on where I'm going to give you something, but you're constantly reminded, okay, this came from this person who is a representative of XYZ medication. And when it comes to clinical trials and research, being a Schedule I drug, we can't use cannabis right now to do clinical trials, clinical research. We could use CBD, but not the whole plant with some THC. So that blocks the ability to do clinical trials, clinical research. And, growing up in New York City, in the Bronx, money talks, bullshit walks. And that's the reality, These guys are coming in with deep pockets, bringing in XYZ, X amount of money, X amount of dollars for them to study their medications and bring out the next great best thing. And so it's a political component, it's a greed-based component. There's a lot of things. And really, how do you monetize, or how can you monetize a plant? Even though there's a patent on it, a federal US patent on it, that I speak about in my book.
Of course there is, by none other than the US Department of Health.
Exactly. For things other than pain, for neurological issues, for neurological diseases. But yet, that is not, it's a Schedule I drug, no medicinal value, high level of addiction, but you have a patent on its use. So once that patent expires and we're able to, monetize it, now you're going to sell it to the highest bidder and then make medications that are in line with synthetics like Marinol or Dronabinol or Sesamet, or worse yet, create a CBD isolate and charge $32,000 a year for a child that has Dravet's or Lennox-Gastaut. I had a family of four. Right. I'm sorry, family of three children. Every one of those children was born with that genetic malformation. Every one of them has Dravet's.
Wow.
Now, imagine $32K per child. You're looking at $100,000. How many people make $100,000 a year? To be able to just take all that money and give it to the pharmacy, because they're not going to eat, they're not going to pay for their car, they're not going to pay for their rent, because it's $32,000 per child to treat them with this medication. That's a CBD isolate that's sold over the counter.
Right. It's criminal. Anyway, we'll just stop with that part of the conversation because I could go all day with you on that. And we're trying to be a hopeful, optimistic.
It's Thanksgiving
podcast.
Day,
and
it's thankful for the fact that 33. Well, no, now there's more, because after the 2020 election, there are more states that have incorporated the use of medical cannabis. So let's be thankful that there are states that have that there are patients that are able to get this medicine. And I no longer have cannabis immigrants where they would sell their livelihood, sell everything that they own, and would move to California or Colorado because they could get their medication there and they were unable to do so here.
Yeah. Well, I think that's great, Dr. Rosado. I think it's a great spot for us to call it a day and let you get back to your business. And thank you so much for taking time out for us on this holiday weekend to be. And good luck with your book, and best of luck to you.
Thank you. Same to you, and as well as your radio listeners. Happy holidays as we enter the holiday season. Please stay safe and healthy, because together with the pandemic, we're also stepping into the flu season, cold and flu season. So that combination can be a recipe for disaster. So please stay safe, stay healthy. And until next year, peace.
Thank you, Dr. Rosado. Have a great day.
You as well, sir. Bye-bye.
Bye-bye. Thank you for listening to today's show. Always brought to you by Magic Immuna Tea, available at packedwithlife.com. A mushroom tea that tastes great. Try it. Magic Immuna Tea, packedwithlife.com.